everyone, welcome to this News Unlocked special. As corona cases continue to rise across the country and cross the 13 lakh mark with a surge in cases of 45 to 50,000 a day, there are still several questions pending. To answer the most frequently asked questions at the moment on corona, I'm joined by one of the country's leading doctors, someone who's at the forefront of this fight, Dr. Randeep Guleria, the director of the All India Institute of Medical Sciences. As always, Dr. Guleria, great to have you on our 2020 FAQs, as we call them. 20 questions and your quick answers to all of them. First of all, the big question, Dr. Guleria. AIIMS today administered the first dose of Covaxin to a 30-year-old. This seems exciting because this is India's first COVID-19 vaccine candidate. The big question everyone wants to know, Dr. Guleria, how soon do you see India being in a position to come up with a vaccine?
So that's a tough question because there are a lot of variables. If everything works well and we were able to show that this vaccine is safe and it is efficacious, and then phase 3 trials show that it is able to give good amount of immunity, it's immunogenic for a significant period of time, then probably we could have the vaccine by the end of this year or early next year. But like I said, there's a lot of ifs and buts because it's a vaccine which has to be first safe, then it has to be producing a good immune response in volunteers. And then when we look at it in elderly and in patients with high risk group, and we give vaccination to people in the community, we would like to see how many of them don't get the infection and are protected. That is the true test of any vaccine.
What you're saying, and I want to get this very right, you're saying if all things go well and you're at a very early stage, the earliest is December or the first quarter of next year, and this would require an expedited process and everything going completely according to plan. Am I correct, sir?
Correct. Okay. And then after that, we have the whole process of mass production. The vaccine has to be produced in huge amount to be able to vaccinate significant amount of the population.
In fact, that's my second question, doctor. In a country of more than 1 billion people, even if a vaccine is successfully developed and tested, it will take months, if not years, to reach the masses. Can anything be done to fast forward this process?
So there are a lot of ways that it can be done. Multiple companies can come together and combine their production plan. India actually currently provides almost 60% of the global vaccine supply. So it's possible to ramp up vaccines as far as a novel vaccine is concerned. But still, I think what we will need to do is prioritize. Those who are at a high risk of having mortality should be vaccinated first. Remember, at the younger age group, the mortality is very low. So the elderly, those with comorbidities or healthcare workers who can get exposed and get serious infection are the ones that we should prioritize.
Okay, so you believe that there will be a process of prioritization when you want to reach the vaccine to the masses. Let me turn, sir, to the third question that I want to raise, the bad news. Because the bad news, Dr. Guleria, is India's infection caseload is steadily rising. No signs of the curve flattening. We've almost seen 95,000 cases being added in just the last couple of days. How worrying is that?
So there are good and bad signs. The bad sign, like you said, is that our cases are still rising. What is actually happening is that the pandemic was initially in large cities. It seems to have flattened out in those areas, but it is now spread to smaller cities and in rural parts of the country. And there are increasing number of cases in some states, in state capitals, which were not there in the past. And therefore, we need to have a different strategy of how do we control the viral infection in these areas. So like I've said in the past, some areas have peaked and are flattening, but there are others which will continue to peak. And as a country, we will see for the next few weeks an increasing trend, which will then flatten out and we will see a decline.
You don't want to give me a timeline by which you think that there could be a decline.
So there will be certain areas which will decline earlier. For example, Delhi has already showing a decline. Certain other cities like Mumbai have also flattened and showing a decline. Certain cities in the south. But there are certain areas like in Bihar or in the northeast or certain other states which are still on the rise and are contributing to this bulk. So the pandemic will shift as it has done in many countries from one area to the other. And as it shifts, we have to sort of develop strategies for that area.
Right. It's
But
interesting.
like I said, the good news is that despite all of this, our mortality continues to be low. And therefore, we are having a much lower mortality than what is being seen in the West.
Right. So that's the good news. The good news is mortality levels are still at around 2.3, 2.4%, or they've come down. The next question, and this is an important one, Doctor. There have been many cases reported in recent weeks of antigen tests giving false negatives. In Mumbai, the Bombay Municipal Corporation has claimed that 65% rapid antigen test results were false negatives, which means that someone is seen to be negative, then turns out to be positive. What's the reason for this? And is there any talk about discontinuing these rapid antigen tests altogether?
So I think the important issue here is to realize when is the rapid antigen test going to be useful. And that depends on what we call pre-test probability. So if we were to do the rapid antigen test in people who have symptomatic, who have symptoms of suggestive of COVID infection, the test performs very well, and almost 70 to 80% of individuals are picked up, and you have around 30 to 40% who are actually false negative. But now if you start doing it in asymptomatic people, where the viral load is much lesser, the test may not perform as well because it does not multiply the virus. What RT-PCR does is it also, you detect the virus and then it multiplies it. So even a small viral load can be picked up by the RT-PCR. The point of care test, the antigen test, gives you the result in 15 minutes or less, but it doesn't have the ability to really replicate the virus and multiply it so that even a small viral load can be picked up.
But should we discontinue? Should they be discontinued, Doctor?
No, I think it's important to realize how properly to use it. Also, I think it's an important issue how you take your sample. If you take the sample from the back of the nose and you put it in both nostrils, the yield is much higher than if you put it in one nostril. So doing the test properly is important, and doing it in the right population also is an important issue.
Right. Let's come to the next question, and this is important again. We've recently come across, Doctor, a few stories about doctors who have said their patients were reinfected with coronavirus after testing negative. That's a worrying prospect. Is reinfection real? How long does the immunity last? You are tested you've tested for corona positive, you go through quarantine, you seem okay, and then suddenly the reinfection comes back. Is that worrying?
So we need to really look at this closely, because this was reported in South Korea also. And it's not something which is very common, but we do know that the immunity varies from individual to individuals, and some people may have a low immunity. But it's also important to remember that some individuals, although they have been cured, may continue to be positive as far as the RT-PCR test is concerned for weeks and sometimes even for 2 to 3 months. And that doesn't mean they've got reinfected. It's just that they keep shedding the dead non-viable virus from the nasal mucosa for a long period of time. And therefore, sometimes they get wrongly diagnosed to have reinfection. It's the same infection which is going on with dead viruses still being present in their throat, which is being picked up by the test. If you were to do a viral culture, it would be negative. And that's why if you look at our guidelines, we no longer recommend that after 10 or 14 days, a repeat test should be done to say that you are now cured.
Interesting, because my next question was linked to that. What precautions should people cured of COVID take? Should there be any precautions that people who have been cured of COVID takes?
So the precautions in terms of them having as far as if they've been cured is really nothing much. What they should do is have a good nutrition, good diet, and start some regular exercise. COVID sometimes leads to what we call a post-viral myalgia. So a lot of body aches, fatigue happen, and by a good nutrition and some degree of exercise, you're able to get over that. But I would say that since we don't have enough evidence in terms of the question that you asked me before,
right,
how long does the immunity last? I think even if you have recovered from COVID-19, you must continue to have your protection in terms of wearing a mask and social distancing even after you come out of COVID-19.
Because my next question, Doctor, is while most people testing positive experience it as a short-term illness, There have been patients talking about symptoms lasting for months, the so-called long haulers, getting breathlessness for months after they've recovered. Is that a concern, these long haulers?
That is a concern, and we're now realizing that there can be some long-term sequelae of COVID infection. Majority of individuals will recover totally. Some of them will have some mild complaints like fatigue, body ache, a dry persisting cough for weeks, but this will gradually go away. But in some individuals, whether it's be the heart, the lung, or even the brain, it does lead to some residual damage. Sometimes it leads to what we call fibrosis in the lung, post-infective. And these individuals then continue to have a low oxygen saturation. We've had to discharge one patient from our hospital on home oxygen because even after he recovered, his saturation was hovering only around 90%, and he would get breathless on mild activity. So there is some individuals will have some degree of residual effect, and therefore it's important that we start looking for this in all those individuals who have recovered from COVID and start a strategy of how do we optimize their functioning so that the quality of life is much better, or they come back to a near normal quality of life.
My next question, doctor, do the doctors think that the rising cases of the Kawasaki disease, like symptoms in children, what doctors call the pediatric multisystem inflammatory syndrome, PMIS, is that worrying that there are children who may be getting this particular type of COVID?
Yes, this is something new that what has been reported. It's similar to Kawasaki syndrome, and it's now been called multisystem inflammatory syndrome of children. It happens after the child has actually recovered from COVID, and he has antibodies have already developed to give him some protection against COVID. And then there's a hyperinflammatory response, which affects various organs. It can affect the skin, the heart, and other organs, and lead to various symptoms. It can have some what we call coronary aneurysms also. So this is something that we're realizing can happen as in children, and it needs steroids, immunoglobulins to be given in these individuals. And I think it's something that we need to follow up in our country also. A lot of these cases have been reported in the West, but we haven't really seen it to a large extent in India.
The next question, Doctor. The Delhi Sero Prevalence Survey showed 45 lakhs out of Delhi's 198 lakhs have had the virus, about 23%, while officially only 1.2 lakhs were confirmed cases. What does this suggest? Does it suggest, as some are now telling us, the onset of some level of herd immunity, or is it that a number of patients are simply asymptomatic, they don't even know they have corona, they recover on their own?
Yes, so what it suggests is two or three things, as a matter of fact. One is that there are a large number of individuals who are asymptomatic or mildly symptomatic, and they don't feel the symptoms are suggestive of COVID-19. They have fever, a little bit of cold, body aches. It goes away in 3-4 days, and they don't feel it was corona infection, and they don't get themselves tested. So it means that we have a large population of asymptomatic or mildly symptomatic individuals, and thereby if we were to add them to what we would call the infection fatality rate, then our overall mortality would be much lower because they also got infected and recovered. So if you were to look at the total number of people who are dying from COVID as compared to all those who got infected, the numbers will actually be even lower, and that makes it a much milder illness. But having said that, it also really tells us that we have a significant number of people who are still vulnerable. 77% of people are still vulnerable to the infection, and therefore even if our cases are coming down, even if the hospital admissions have come down, we still have a large population in Delhi which can get the infection, and therefore all the infection control measures, containment strategies still have to be in place because we haven't reached that number that we can say that there is good amount of herd immunity.
There is also a fear, doctor, of underreporting of cases and deaths. Is that a genuine fear? Do you believe that the numbers being reported are honest numbers?
So I think they are, because even if you look at deaths, which are overall deaths, let's say not only related to COVID, but even non-COVID deaths which are being reported, and you can't sort of fudge that number because you will have the data coming from the burial grounds, from the crematoriums. That also is not showing any disproportionate increase as far as the number of deaths are concerned. So I don't think there is a disproportionate or underreporting of deaths. We are seeing deaths as they are being reported. But I do agree that we need to be vigilant that some individuals may not come forward to get themselves tested, although maybe having classical symptoms of COVID-19. The reason why I worry about this is that, okay, majority of us will get over it, but some may actually go on to have a serious illness and come to the hospital very late, and that may actually contribute to a higher mortality.
You know, the next question, are there enough test kits, doctor, reaching smaller cities? Because many believe that's where the numbers are going to grow now, the smaller towns. Do you believe we have enough test kits now? Are we testing enough?
So I think this is one area where the government has worked aggressively on. If you remember, when we started in this pandemic, we were only doing around 10,000 tests a day. We had a handful of labs which could do the test for COVID-19. We've now crossed 3.5 lakhs tests per day. And we have now more than 1,200 labs which can do RT-PCR tests. And now we also are having the rapid antigen test available also. So I think the strategy has been to really reach out to smaller cities and rural India to see that we can test there. And that's how the labs have been developed. The important issue is to now see that wherever there is a cluster or increasing number of cases, we can increase the number of kits that are available and the human resources that are required to do the testing out there.
That's right, because we are finding in states like Bihar, that's a big problem, the human resources available to do some of the testing, and that's an issue which might trouble us later on. You said, sir, that cities like Delhi and Mumbai may have peaked. Are you sure that it is under control in these metros? And can I also add to that the question, do you therefore believe the time has come to restart public transport in these big cities, a metro in Delhi or commuter trains in Mumbai?
So I think the issue here is how responsible are the citizens of the city. Because if you start these services, you have to be very careful that everyone follows the norm which are important, that is wearing a mask, maintaining social distancing, hand hygiene. Because as we've seen in some cities in India and even in the US, that once you start opening up, people sort of think that the lockdown, that the COVID has gone away, and they sort of forget their responsibility, and you see a resurgence of cases. So my main concern is that unless we can be really sure that people will behave responsibly, and we continue to have very aggressive monitoring in terms of even fines, it will be something that we will have to consider, because I know that there are certain cities which opened up and then had to have a lockdown again because of the
So you don't
that,
recommend opening up a public transport right away, am I correct?
So I think whatever we do should be done in a graded manner to see how things are, and if we are able to keep the numbers down and people maintain social norms.
That's an important point that you're saying. Very quickly, we are seeing a southern surge in recent weeks, Doctor. Andhra Pradesh has now seen a big surge. We are seeing it also in states like Tamil Nadu, even Kerala, registering a high number of cases. Which are the concerned states? Are it the southern states, or dare I say, is it Bihar, where the medical infrastructure is under stress? Which is the biggest concern, you would say, going ahead in the next month?
So some of the states that you mentioned, Bihar, Andhra, Telangana, and some states in the south. But I think most of these states are now working aggressively to bring down their cases. They have realized that they have to look at their own models, and testing, tracking, isolation becomes more and more important in these areas.
So, but Bihar doesn't seem to have, sorry to intervene, states like Bihar don't seem to have enough beds at the moment. The hospital infrastructure seems to be struggling. Do you believe the North Indian states, the so-called Bimaru states, need to wake up?
So I would say that all states where the cases are increasing need to work aggressively, both in terms of hospitals, infrastructure, and also in terms of increasing testing and trying to develop containment strategies. Because one part is the hospital care, but the most important part is the containment and preventing the rise in number of cases, which means that you test, you identify clusters, you have strict containment policies so that you decrease the number of cases. And if you decrease the number of cases, the strain on the hospital will automatically come down.
Right. So Bengal has gone for a 2-day-a-week lockdown. They claim that they've based this on a model of Indian Institute of Science in Bangalore. Do you believe such short-term hard lockdowns are a solution at all?
Short-term lockdowns have a problem because they don't really go through the incubation period of the virus. You may just have a slight interruption in the spread, but it's not going to have a long-term sustainable effect. So I think it needs to be looked at the strategy actually needs to be looked at more scientifically as to how effective it would be. It would be more useful to look at lockdowns in areas where you're finding a cluster and have a lockdown for a sufficiently long time there till the number of cases start decreasing, have good perimeter control so that there's no leakage of cases from that area to the other areas. And that probably would work, and it will lead to less disruption as far as day-to-day work is concerned.
You know, what about schools and colleges, Doctor? Do you believe that they can open within the next month? Many schools and colleges are still closed. Most schools and colleges are still closed. Do you see that happening at all by August end, or do you believe schools and colleges cannot open at this stage?
I think it's really difficult right now to say that schools and colleges can open. As you rightly said, the number of cases are increasing. Until we're able to show that there are significant decrease in cases all over the country, it's a little bit of a risky thing, because in schools and colleges, it's very difficult to maintain social distancing. There is a very high chance of a cluster developing there, and then children taking the infection to their house, and then elderly getting infected. So I think that is something that we need to consider very cautiously, and I don't see it happening in the very near future.
We're also entering, Dr. Guleria, the festive season. Is there any specific precaution that you believe must be taken as we enter this festive season?
So this is going to be the biggest challenge over the next few weeks, because as the festive season comes and many parts of the country will have start celebrating a lot of festivals, we will have to do so with a lot of constraints, because like I said, we can't do away with social distancing, with wearing a mask. So celebrating or having all these festivals with all these restrictions is something which is going to be challenging. But I think it's important that we do that, because none of us would want that we have increasing number of cases or mortality because of some festival.
In conclusion, Doctor, total deaths in the country over 30,000. Would you say that mortality rates though are under control, and is there something that we could have done differently that we haven't done since February?
So I think mortality rates are lower, and if you look at deaths per million population, it's very low. And like I said, if you count the asymptomatic individuals based on the serosurveillance, it will even be much lower. So we need to continue to work. We've done a lot of work in terms of COVID care centers, COVID hospital, COVID ICUs. But as the pandemic moves from cities to smaller towns, we need to continue to work aggressively so that we can provide quality care to every citizen, no matter where he is, and be able to survive.
And are the most vulnerable still, sir, those who have comorbidities, those who are senior citizens? Is there any change in that? Do you still believe that those are still the most vulnerable groups?
Yes, so I think that is the other responsibility that we have. We should protect the most vulnerable groups, those who are the elderly with comorbidities. So a very aggressive action in terms of seeing that they don't get an exposure and they don't get the disease is something we need to do across the country.
My final question to you, sir, and this is on a lighter side. A union minister suggested that maybe have papad. It can be a COVID cure. Are any of these, someone has even put out an advertisement saying wear a particular kind of clothes, it's a COVID free suiting. Do you believe any of this works?
No, I don't think so. I don't think there's enough scientific evidence to really suggest any of this works. I would still say the most important thing that works is physical distancing, wearing a mask, and regularly washing your hands.
Okay, so it's back to the basics. What you're saying is continue with the basics. We're still in for a long haul. Dr. Guleria, as always, it's a pleasure talking to you, because you make sense of all that's happening around us. I wish you all the very best with the vaccine. That, in a sense, seems to be the big game changer, hopefully. Thank you so much, Dr. Randeep Guleria, Director of All India Institute of Medical Sciences, for joining us on our FAQs here on the News Unlocked. Thanks so much for watching News Without the Noise. Bye for now.
Rajasthan Battle Royale shifts to